to join, and then we're going to get started in about 2 more minutes. Okay, well, we're going to get started with our lunch and learn today. Thank you again all for joining us. My name is Liza Weiss. I'm the Executive Director of Missouri Appleseed. The lunch and learn today is hosted by Missouri Appleseed, Dignity Period, St. Louis University, and the Missouri Coalition of Diaper Banks. I'm the Executive Director of Missouri Appleseed. We're a small nonprofit with offices at St. Louis University Law School. We work on improving policies and systems at the intersection of public health, criminal justice, and child welfare. We've done a lot of research on access and advocacy on access, menstrual products for incarcerated women. Our research and advocacy has led to legislation in Jeff City, ensuring that all women who are in jails and prisons in Missouri have access to free products. We've also worked hand in hand with some of the other hosts of the call to ensure that the state appropriates funds, not only for women in jails and prisons, but also for students in grades 6th through 12th. And that's why we're here today to talk about this grant program. I'd like to introduce the other hosts of our lunch and learn. We have Dr. Ann Seabrook-Coleman from St. Louis University. She's a professor at the College of Public Health and Social Justice. Dr. Coleman has done extensive research on access to menstrual products, both for students in St. Louis area schools, but also women in our community. Her research has been recognized in scholarly articles, but also in national and local media. And a lot of her research is what led to the appropriations of the funds we're speaking about today. Angie Wiseman, who is the executive director of Dignity Period, Dignity Period is an organization that educates and provides products both in the United States and internationally. Since its founding in 2014, Dignity Period has worked in regions of northern Ethiopia to educate over 300,000 female and male students about menstrual periods to alleviate the fear and remove the stigma often associated with them. Dignity Period has also distributed over 165,000 menstrual hygiene kits to girls in Ethiopia. These kits contain 4 washable, reusable pads and 2 pairs of underwear, enough to meet their needs for at least 12 months. And we're also joined today by Muriel Smith, who is the executive director of the St. Louis Area Diaper Bank. The St. Louis Area Diaper Bank not only provides diapers to people in the St. Louis area, but also period products. In addition to providing these products, the Diaper Bank is also very active advocacy and has been instrumental in achieving these funds at the state level for our schools. So without further ado, we'd like to now move on to the heart and the meat of the lunch and learn, to learn about the allocation of funds and how we can schools across the state can access them.
Liza, thank you for the introduction, and thank you to everyone for being here today. As Liza mentioned, I have done a good bit of research over the past few years, starting with adult women in the St. Louis area, but then more recently with students and with schools and with school nurses. that I think really highlights what some of the needs, why this grant is so vitally important, and hopefully how it can be filling one of the needs that we've identified. So I just am going to review the data very quickly. Some of your schools or nurses that work in your schools or your districts have participated in this research, and so I greatly appreciate that. But one of the things that we've seen working with students and the high school students is that more than 70% of them report that during the school year, they miss school at some point during the year for a reason related to their period. Now, this is not just because they don't have products when needed. It might be pain and cramping, heavy flow, bad odor. But I think it shows how tied menstruation and management of menstruation is to school attendance. If we look specifically at students missing school because they don't have period products when they need them, kind of depending on the survey, it ranges anywhere from about 13 to 34 or 18 to 34% of students who have reported that they're missing at least one day a year because they don't have the products when they need them. On the flip side, students really see schools as a resource, as a place where they rely on and they get products. So we see that over 60% of the students say that they have obtained products, period products, through one of the sources at school at some point. So periods are affecting students' attendance at school. There's a particular need for those who don't have products when they need them, but they're also relying on schools as resources to access products. Next one. We shift and we look at from the school nurses' perspective. We hear from school nurses that they are also very much aware of how menstruation is affecting students and how access to period products can be a challenge for a number of their families. So we surveyed nurses in schools across the state of Missouri. So these results hold true both from urban schools and rural schools, from small districts and large districts, across kind of the spectrum of race, ethnicity enrollment in districts. And so we see that over 70% of school nurses are aware of students that they serve in their schools and districts who those students and those families are struggling to afford the period products that they need. And about 20% of nurses know students who are managing their periods on a regular basis just from homemade pads and tampons, right? So taking toilet paper, Kleenex, paper towels, and just wadding it up and making that for their pad or tampon. A small percentage know students who have had reproductive tract infections explicitly because they haven't had an adequate supply of difficulty accessing products during the COVID-19 pandemic. Next slide. And yet, despite this, we see that schools are reporting running out of stock of period products. So this looks at the 2 years prior to DESE making that grant available last year. So the feminine hygiene grant that we're talking about started last school year. So if you look at that bottom box in the school year, 2 school years prior to that, 2020, 2021, it was 23% of schools reported that at some point during the school year, they ran out of period products for their students. I know the box says through March, but for that one, it's the full school year. And then if you go above that, 15% reported sometime in the 2021-22 school year through the beginning of March that they had already run out of stock of period products. So we know this is something students need. We know that they rely on resources at school. We know that nurses are aware of this issue, and yet schools are running out of stock of products that are needed for their students and needed to help keep their students in school. So this is why we're excited that DESE has made this grant money available. And Mary, I'll turn it over to you from there to talk about the details of the grant and how schools can access the money allocated to them.
Great. Thank you, Anne. Yeah, so I'm just going to kind of walk through the guidance that DESE has provided as far as the grant for this school year. And we'll have, if you have questions after that, you can feel free to answer those. And we'll have a contact for you to reach out to at DESE as well if you have more in-depth questions about the grant program. So the basics of the grant, the purpose, as we see it, of the grant is to provide financial support to LEAs for the purchase of feminine hygiene products for current students in grades 6 through 12. It also is going to help to have a funding mechanism for schools to purchase these items without utilizing either donations that the school asks for throughout the school year or staff having to purchase those products that students need. And as you have heard from Anne before, it will help ensure that students with periods have access to period products while they're at school, which is a huge need. And to a certain extent, it will help to decrease stigma around having a period because they'll have access to these products at school where they spend a bulk of their day during the school year. So the grant details, just a high level, DESE has allocated $1 million for this grant for Missouri LEAs. And so that's public and charter schools throughout the state of Missouri. The minimum grant award is $500 to ELAs. We'll provide the guidance document to you after this meeting is over, but most schools will get more than that, but the least you will get is $500. The grant covers this school year, so 2023-24 school year, and it's a reimbursement grant. So schools have to make the purchases first and then submit receipts for reimbursement. And all ELAs were awarded, like I said, a minimum of $500 regardless of your size. And this is coming from the guidance document that kind of speaks to how they determined the amount that you get and how many students, female students. So they looked at the number of female students in grades 5 through 11 in order to provide the amount that each school would get. So how you apply, and I believe all of you utilize this system. You may or may not know about it, but this EPEG system, and the grant should be available to apply for reimbursement sometime this month is what we were told. So each school can submit up to their allocated amount, which is based on the number of female students in grades 6 through 8. Plus times the census poverty multiplier. So you will have, number of female students based on that, and that's how much money you will have. And that's for the school district. So the amount that's in the guidance document that DESE provides, it's for each school district, which means each individual school, the elementary, middle, high school, you'll take the number of female students you have enrolled and then multiply it by this amount that's in the guidance document to figure out how much your specific school might have available. Eligible products for reimbursement include all of that are listed here: disposable products, reusable products, cleanser related supplies, dispensers for you to utilize in the restrooms, hopefully, undergarments, shorts, so extra clothing if needed, and then some pain medication that you can purchase. All reimbursements have to be requested, like I said before, through this EPEG system, and reimbursement request can be submitted through May 31st of 2024. So that's how long you have to submit your reimbursement for the items that you've purchased for your school. So that's it. The guidance document is very basic. It provides the guidance of what we put up on the screen, and then does outline what each school district is allotted. So that is in there. Once you receive that, you can see that. Does anyone have any questions about either Anne's research or any questions we might be able to ask about the grant, or about, you know, even why you should be applying, why you should apply for the grant for your school? And feel free to
Were all those
go ahead.
Were all those numbers Missouri or St. Louis, or for the research, like the 70% of students that missed due to not having products? Was that nationwide?
No. All the data that I presented was Missouri-based data. Yes. And if anyone's interested in the actual journal articles, I can share those if you send me an email.
Was the $500 minimum grant award per school or per district?
It is per district.
Okay.
It's based on your district size times the amount that they're allocating per student times a census poverty multiplier is what the district is allotted, or $500, whichever of those two is greater. So some very small districts in the state would not have gotten to $500 through the formula of amount per student. And so they use 500 as the minimum. And then most districts go up from there because they have larger enrollment.
Thank you.
Are there any other questions, either about Anne's research or about the grant?
Yes, I do have a question. I'm with Riverview Gardens Parents as Teachers, and the information you shared, it seems like it's specific to elementary and secondary. So would the Parents as Teachers programs, would they qualify? Will we qualify for the grant? We're currently distributing period products to our families.
So the Riverview Gardens School District would need to, there is an allotted amount for the school district, and they would need to submit receipts. So I think it depends on how you work with the school district in that way, because it's the school district that is eligible through this particular grant.
There is another question from Madonna Woods in the chat that says, will organizations such as Midtown Community benefit from this? We have an after-school program. So I think that answer is sort of the same answer that Anne gave to the Parents as Teachers. It is specifically for schools. So if you are working with the school, I guess, you know, and depending upon your relationship with that school and how you guys work together, they would have to apply for it though, and apply for the reimbursements.
But hopefully having this money available might give schools a little bit of flexibility, for example, to apply for or to purchase more or a greater variety of products around menstrual hygiene, and then potentially, depending on how the district works with their before and after school programs, or with parents or teachers or something like that. So it's definitely something to work with your school district around.
And then Matthew asked, will there be a project code associated with this grant? So I think that would be a question for Shelley, who is the contact at DESE, to ask. I'm sure there will be, but she can certainly answer that question because it is through the EPEG system. Joyce.
And Muriel, do you want to switch to the next slide that has Shelley?
Yes. Do that.
Yeah.
Another question from Joyce, should the schools work together as a team to get the variety of products needed? As a school district, you mean? I certainly would hope that, again, it's you have to go, the grant goes, the reimbursement will come from the school district. So you will have to, know what your specific school needs and then communicate that to the district when you're doing the reimbursement. Am I saying that right, Anne, with how that?
I think so, yes. So my understanding is the district, the LEA, so if it's a charter school, then if there's a conglomeration of charter schools under the same LEA, the amount allocated is sort of the maximum for the total in there. And so you'll need to work within that district or LEA to get the reimbursement submitted.
Are there any other? Oh, go ahead.
Oh, sorry. We receive period products from Giving the Basics. Would applying for this grant interfere with any of our Giving the Basics? Are we allowed to receive money and still receive product from Giving the Basics if there's a need?
I did not see anything in the guidance document that said anything about how else schools or districts received products.
Okay.
So it's probably a question to direct specifically to Shelley just to confirm, but I've read the guidance document and I was actually on a like a lunch and learn that Shelley did, and I have not seen anything that would suggest that this would prohibit you from getting products from an additional source or additional sources.
Okay, cool. Thank you.
And note that that slide that Mariel showed with what you're eligible for. So under this grant, it's not just products directly, but for example, underwear, over-the-counter pain medication, those types of things. So your district might want to think about sort of the range of things that are needed and what can be accessed from where.
Perfect. Thank you.
And I would just add, this is Liza from Missouri Appleseed, that we recognize that the amount of funds that they've allocated might not be enough to meet all of the needs of school districts across the state. So if all the funds are, the $1 million funds are all drawn down, that will give us, it'll help us argue next legislative session that this amount of funding, this allocation should be increased to support Missouri students. We're hoping this is just a starting place.
And we hope that everybody who's on here from a school or works with the school to take back this information to either your principal or your school administrator. They should all know that this is available because Desi did give this to them and tell them about it. But you guys are usually the ones doing the work in the schools and know the need. And so I would definitely take this back to your principal, your school administrator, to let them know that, you'd like to do this. And, from the document, you'll be able to see how much each school district is allotted. And then you can ask your individual principal, how to give you the specific numbers of female students. And then you can do the multiplier to figure out how much money your individual school has. And then hopefully you can start purchasing these items to provide them to your students. Are there any other questions we can answer? Well, certainly contact Shelley if you have questions about the grant, and then the EPEG system. You can contact Andy at Desi if you have questions about the reimbursement. We will send you the guidance document. We'll also send the recording of this meeting as well. So if you wanted to pass it along to your administrator or your principal for their information, that would be great. And then you'll have that guidance document to also share if you would like to share that with your principal or school administrator. And we, hope that this helps your schools and that you all use all of the money so that we can go back next year to request a larger allocation, because we know $1 million to provide to however many students across the state of Missouri that have periods is not enough. And we really want to be able to have enough money to provide these products to students and schools on an annual basis, and the amount that you all need for your students. All right, and if there's no other questions, we will also have our contact information in that follow-up email in case you have additional questions about Ann's research or about the advocacy efforts that Missouri Appleseed does or the Missouri Coalition does. And thank you all for attending today, and I hope you all have a good week. Bye.
Thank you all.
Thank you.